Sea turtle rehabilitation for toxic algal bloom on Florida's Atlantic coast. Florida Atlantic coast provides vital habitats for three key sea turtle species: the leatherback, loggerhead, and green sea turtle. These sea turtles rely on sandy beaches for nesting, while seagrass beds and coral reefs serve as important foraging grounds. However, these environments face numerous challenges, including coastal erosion, strong ocean currents, and the impacts of high tourism, urbanization, and habitat destruction caused by human activities. The region experiences a subtropical climate characterized by hot, humid summers and mild winters. The hurricane season, lasting from June to November, poses additional threats to turtle habitats. Nesting activity peaks between March and October, making this a crucial period for conservation efforts. Understanding these environmental conditions is essential for developing effective rehabilitation strategies for sea turtles in this region. The Florida Atlantic coast plays a crucial role in the life cycles of multiple sea turtle species. Leatherbacks use the area primarily for nesting and as a migratory passage. Loggerheads rely on these waters both for nesting and foraging, while green turtles not only nest here, but also depend on the region for juvenile development. Juvenile and sub-adult turtles frequent seagrass beds and coral reefs to forage, gaining the nutrients necessary for growth and survival. Meanwhile, nesting females and hatchlings face significant vulnerability during the nesting season, as they are directly exposed to environmental threats and human disturbances. Protecting turtles at these crucial life stages is essential for maintaining healthy populations. Challenges faced due to toxoalgae blooms. Toxoalgae blooms present serious challenges to sea turtles among the Florida Atlantic coast. Exposure to these harmful blooms can lead to neurological effects, causing disorientation and difficulty in movement, and even seizures. Respiratory distress is another major concern, as turtles may inhale or ingest harmful toxins, leading to breathing difficulties. Additionally, toxic blooms contribute to food insecurity by contaminating seagrass beds and other vital food sources, making it harder for turtles to find safe, nutritious food. Digestive system damage can occur when turtles ingest algae contaminated prey, leading to long term health complications. Skin and eye irritation from exposure to toxic water further adds to the risks of these turtles' faces. Addressing these challenges is essential to ensuring the survival of affected sea turtle populations. When sea turtles affected by toxic algae blooms arrive at the rehabilitation center, a structure response protocol is essential for their recovery, ensuring that all aspects of their health are thoroughly addressed. In the first phase, intake and stabilization begins immediately upon arrival. The veterinary team performs an initial comprehensive assessment. This includes documenting the turtle's physical condition, including weight, shell integrity, and hydration status, and observing for signs of neurological symptoms such as seizures, disorientation, or uncoordinated movements. Respiratory distress is closely monitored as it is common in turtles affected by harmful algae blooms. Blood work is conducted to check for elevated toxin levels, infection, or electrolyte imbalances. If a turtle exhibits signs of respiratory distress, such as labored breathing or low blood oxygen levels, oxygen therapy is initiated using an oxygen chamber mask or a mask, depending on the turtle's size. For neurological symptoms such as seizures, tremors, or disorientation, anticonvulsants or sedatives may be administered to control the symptoms, and turtles are placed in low stimulation, quiet environments to reduce stress and promote neurological recovery. The rehabilitation team carefully monitors vital signs, including heart rate, respiratory rate, and temperature, to assess the effectiveness of interventions. Decontamination follows, ensuring that the turtles are thoroughly cleaned to remove residual toxins. Toxins are rinsed with clean, filtered seawater or freshwater, depending on their tolerance, to eliminate external contaminants. In cases where ingestion of toxins is suspected, activated charcoal is administered orally to help any remaining toxins in the gastrointestinal tract. Intravenous fluids are given to maintain hydration and restore electrolyte balance, which is crucial for turtles suffering from the dehydrating effects of toxins. However, loggerhead turtles often require a specialized dehydration treatment protocol due to their more extreme neurological symptoms caused by baryvotoxins, as seen in red tide blooms. This treatment involves carefully managing dehydration to alleviate the symptoms of baryvotoxins, which can include coma and severe disorientation. Dehydration therapy has been shown to be an effective intervention as it helps address the systematic effects of the toxins and supports the turtle's recovery process. This treatment is followed by supportive care measures, including hydration and ongoing monitoring kidney function. In some cases, systematic antihistamine treatment is used alongside dehydration therapy to address the effects of toxins, specifically for loggerheads. Once these initial treatments are administered, the turtles are closely monitored for signs of improvement, with additional supportive care as needed. In the second phase, long-term care and rehabilitation focuses on the turtle's full recovery. Nutrition plays a crucial role in the phase, and turtles are provided with toxin-free, easily digestible food tailored to their specific dietary needs. Monitoring of their feeding behavior is vital, as some turtles may experience a reduced appetite or difficulty eating due to neurological impairments. Physical therapy is essential for restoring swimming ability, muscle tone, and mobility. Controlled swimming in shallow warm pools allows the rehabilitation team to assess the turtle's buoyancy, swimming proficiency, and coordination. In some cases, physical therapy may include passive range of motion exercises to maintain joint flexibility and muscle strength. Turtles with severe impairments or injuries are kept in rehabilitation tanks with specific water conditions such as temperature and salinity. Quarantine procedures are implemented for turtles that are severely affected by toxins. Quarantine turtles are monitored closely and their behavior and condition are regularly assessed. Strict biosecurity measures are adhered to in the quarantine area to minimize the risk of cross-contamination with other patients. Before release, a final behavioral assessment is performed to ensure that the turtle has regained the skills necessary for survival in the wild. This includes testing their ability to navigate in open water, forage for food, and dive to appropriate depths. Successful rehabilitation is also gauged by their ability to respond to environmental cues and demonstrate normal swimming patterns. When the turtle is deemed fit for release, it is carefully transported back to its natural habitat. The entire rehabilitation process is highly structured and relies on constant observation and timely interventions. Each step from intake to release is designed to maximize the turtle's chances of returning to the wild and thriving in its natural environment. Once a rehabilitated sea turtle is ready for release, a structured release protocol ensures the best chance for survival. The process begins with a pre-release health check where veterinarians confirm that the turtle has normal neurological and respiratory function, and ensuring that it can survive in the wild. Next, tagging and tracking involves fitting the turtle with satellite tags to monitor its movements and survival post-release. This data helps researchers understand migration patterns and long-term effects of red tide exposure. Choosing a safe release location is crucial. Turtles are released in areas free from red tide contamination to prevent re-exposure to harmful toxins. Finally, community engagement plays a role in conservation efforts. Rehabilitation centers collaborate with local organizations and the public to promote awareness and mitigation strategies, helping to reduce future red tide events and protect sea turtle populations. In conclusion, this rehabilitation protocol provides a structured and effective response to toxic algae blooms along Florida's Atlantic coast. By focusing on rapid intake and stabilization, addressing long-term health impacts, and ensuring safe release strategies, the Rehabilitation Center can significantly improve survival outcomes for affected turtles. Beyond individual care, these efforts contribute to a broader conservation initiatives, helping to protect vulnerable sea turtle populations from ongoing threats like red tide. Moving forward, continued research, such as studying long-term neurological effects of red tide exposure, will refine treatment strategies. Monitoring programs, including satellite tracking of released turtles, will provide insight into post-rehabilitation survival. Community engagement efforts, like public education campaigns and partnerships with local fishermen and beachgoers, can help mitigate future events by promoting healthy protection and pollution reduction. References.